Welcome everybody. We're here with Deb McPhee, licensed professional counselor, and today we're going to be talking about what is therapy. Welcome, Deb.
Thank you. Thanks for having me.
So I was hoping you could tell us about what is therapy, why it's important, and for those out there who've never experienced anything about it, what's important?
What's important, yeah. I picked the topic because I have a lot of people coming in and not knowing what to expect. And so a lot of times they've never had counseling or they had it long ago and they just like, what am I in for? Regardless of what kind of therapy you offer, whether it's cognitive behavior, dialectical behavior therapy, EMDR, it's a process. It's a relationship. It's at least two people that are providing attention, focus, and concentration on one person's life, which can be very powerful, right? A lot of potential. And so we have this process, this relationship, and when the client wants to integrate their spirituality, their faith, then the potential for progress and growth is magnified because now we're bringing in their faith also to look at one's life, right? So here we got this relationship. It's a working relationship. It's certainly a process. This is not something that's going to happen overnight. And that's something that I emphasize with my clients is, it's going to take a little while, all right? And one thing that I want to emphasize, while our clients might be coming in with some problems and they're discouraged, they're coming in with a level of courage. Because think about it, they're coming in, they're sharing their problems, they're talking to a total stranger, and they're entrusting their life to the therapist. So that takes a level of courage that, again, we want to take that courage and give them a feeling of trust. So this process, this relationship, is based on, regardless of what kind of therapy you're going to be getting, is based on trust. Because without trust, nothing's going to happen. We got to have that trust. That client comes in with the hope that you're going to help me, you're going to help me solve something, you're going to help me move past this, and I'm trusting you. So while the client brings in his problem, and a level of courage, one of the main things that the therapist is tasked to do is not only establish, but then maintain this level of trust so that good work can happen, right? So we've got a relationship, focus, attention, and concentration based on trust, regardless of what kind of therapy we're doing, right? We got that trust. And then the therapist conveys that level of trust through role modeling, competence beyond book knowledge, right? He or she is a teacher and also conveys an attitude that they're just as interested in the client's progress as the client is interested. We're going to mirror that interest back to the client. So these are some things that when a client comes in, these are some things that they can expect, hopefully, because we want to do the good work. Going back to this courage, this level of courage, and this is where it gets a little scary for people, because now another task that the therapist must carry out is offer different perspectives or maybe uncover some behaviors or patterns that are very hard for the client to look at. And they might unwittingly, be unaware that, wow, I'm perpetuating my difficulties. But again, that takes a lot of courage to even say that or to realize it. It takes courage to do the work between sessions, to kind of take away, we covered this in a session, and then kind of sit with it. So again, that trust, I don't care what kind of therapy you're offering, that trust has got to be there, and not only established, but maintained throughout the length of whatever the service is. The other thing is we want in this good therapy, we got this good relationship going, we want to develop not only, again, the courage to continue to look at maybe some new ways, teach them some new skills, give them something to kind of like, try this on for size type thing. But we also want to nurture a level of independence where they can think on their own, make decisions on their own, and feel good about their behaviors. Feeling good about, hey, you know what? I came up with that myself. I'm going forward with it. So we help them develop maybe a sense of quiet confidence of trying on some new skills. That one doesn't fit. I'll try on another one.
It sounds like there's a lot of responsibilities between both the client and the therapist.
Thank you. Yes.
Whose responsibility is it to make sure that it's good, that it's good therapy?
Yeah. Well, okay, again, if we've got that trust, checking in with the client every so often to say, what can we be doing differently? Or, what are you most comfortable with so far? Or what are you feeling good about? That kind of that periodic checks, doing the check-ins. This is your 4th session, 5th session. What do you like that we're doing? What do we need to stop? It doesn't have to take a whole session, but just kind of doing a checkpoint type thing, because that too also instills that level of trust. Hey, it's more than just attention this woman's giving me, the therapist is giving me. They really care about my progress. They want that quantity and quality in there, okay? So yes, I make it clear, and it's imperative that the client does have some responsibility in addition to showing up every week or every time with this level of courage of like, yes, I'm exposing a lot of what's going wrong, my dysfunction, I need help. Again, that takes a lot of courage.
And being open to change.
Absolutely, absolutely. So that in itself, being respectful of what that client brings in each time he or she shows up, and regardless of what the age, even a little one, again, it takes courage to sit there and say, well, this is not working for me.
What would be your advice to somebody who's never come into therapy about how to gain that courage and how to take that first step?
Okay. Do some research and know that therapists are kind of like trying on coats. You try on a coat and that one doesn't fit. You have the right to kind of say, you either speak up and say, I need more of this and less of that. All right? Because again, you're purchasing a service, right? And it's a form of self-care. And you certainly don't want to pay for something that's, wow, man, this isn't working, but I'm just showing up. So again, do some research. Say, and most websites, kind of give you an idea. Well, actually that sounds pretty good. I'll check this one out. But it's okay to speak up and say, I need more homework. Or, that list of those books you gave me, it's not making any sense. But see, again, that level of trust is there. I trust you. And therapist, is only human too, right? So the therapist has got to be able to say, you know what? Wow, I messed up. Again, role modeling that, hey, I make mistakes too. So let's look at something different.
That's great. I really appreciate that.
Thank you.
I hope that helps our viewers get a little bit more on what therapy looks like and
I hope so too.
how that relationship can turn out. Thank you, Deb.
You're welcome.